So my name is Sophia Guzman. I'm going to be the OTA today, working with my patient on a supine to sitting position and from a bed to chair transfer. So the importance of this is that it's always important to be safe and make sure that the patient is ready to do the transfers, because if not, that could create an injury or just hinder their balance and overall make them worried if they have to do this on their own. So first we're gonna move the patient's legs into a uprise position on their knees. So I'm just gonna carefully move them up. Does that feel okay?
Yes.
Okay. And then actually we're gonna have you scooch just a little more inward towards the wall with your hips, just a little, like scooch up. Yep. And then we're going to just have you can bend this arm here, and then we're gonna have you hold yourself here, and then I'm going to gently roll you onto your side. Is that okay?
Yes.
Okay, so we're gonna roll, and then I'm gonna hold her so that she doesn't actually fall off of the bed, and then I'm going to gently move her legs off of here, and then hold them with my leg, and then I'm going to put my hand under her shoulder, and then push slightly on her hip to use her body mechanics to help her sit up, just like that. And then this position is helpful for people who are needing to get dressed on their own, because they will be able to put their shirts and blouses on easier, because it won't be getting caught against the blankets and sheets. And also for lower body dressing, this is important because they can put on their pants easier with reachers or any adaptive equipment that they have. So next, we're gonna work on a bed to chair transfer. So we are going to put the chair as closest to them as possible while still having room for me to help them. Then we're going to use our gait belt, this device here, which will help us keep them safe and us safe as well. So I'm just going to reach around you and then put this on. You want to have this on pretty snug, but not too snug where you can't put a couple fingers in. So we're just going to keep threading this in until you can just put just a little bit of room in there. And then we're going to thread it through again, and then you can just tuck that in there, just so it's out of the way. So then I'm going to position her legs just a little bit so there's room for my leg to go in there to stabilize her knees when she stands up. We're going to want to have them scooch towards the edge of the bed as much as possible. And then on the count of 3, I'm going to have her lean towards me with her upper body, not putting all her weight, but most of her weight on me, and then have her stand, and then we're going to just shuffle our feet towards the chair. So she's gonna shuffle towards her right side, and then I'll place her softly on the chair. So on the count of 3, you're gonna lean towards me and stand up. 1, 2, 3. And then we're going to shuffle, shuffle, and then you're gonna lean back and sit. So it's important to not just use your upper body strength, you wanna use your lower body, because that way you prevent injury in the client and the therapist. And we also wanna make sure that they're at the back of the chair, because if they're on the edge, that can create problems if either they're unbalanced or they can fall out of the chair, and you just want them to be as stable as possible. So thank you for watching the supine to sitting transfer and the bed to chair transfer. Thank you.